Hi, my name is Bonnie Keating, and I'm presenting to you my capstone project. So the title of my project is The Correlation Between Sleep Deprivation and an Increase in BMI Among Shift Workers. Did you get enough sleep last night? It is reported that 35% of U.S. adults are not getting the recommended 7 hours of sleep each night, according to the Center Disease Control. And as you can see here, according to a study, the Gallup poll in 2014 reported Americans work 47 hours per week, and that's about 9.4 hours a day. So that is a significant increase from the last 10 to 20 years. So Americans are working more and they're sleeping less. Many Americans report that they work almost 50 hours a week, so some may have multiple jobs, or some jobs just may require that many hours in a week. 25% of Americans report that their job doesn't allow them to get sufficient sleep. So data also reflects that people who work greater than 48 hours a week are higher risk for sleep problems. And shift workers have a higher risk for these sleep problems. So data collected between 1959 and 2005 showed that sleep was continuously decreasing regularly about an hour and a half a night. It's reported that people put sleep at the bottom of their list when you think of a hierarchy of needs that are important to them in regard to health and their well-being. And it shows that people are putting that on the bottom because they're putting other things in life to put, first, whether their family, their job, and putting down the quality of sleep down at the bottom of that hierarchy. So, lack of sleep and health. How does a lack of sleep affect your health? Studies have suggested that short sleep duration is associated with hypertension, cardiovascular disease, stroke, type 2 diabetes, and obesity. Poor sleep can lead to sleep disorders and depression. It can also influence weight gain through the effect of your appetite, so you might crave foods that aren't as healthy to you because of that can cause weight gain because you're not sleeping enough to make the right choices. It can bring down your physical activity because you're just tired, and then it affects your thermoregulation, how the rate at which you burn calories can also be affected. Chronic and partial sleep deprivation can lead to feeling of fatigue, which I said before reduces physical activity. Sleep deprivation may also affect you in taking more calories. So let's look at shift work. Shift work is defined as employees that rotate between day, evening, and night shifts. 29% of U.S. workers have times work outside the normal range between 6 a.m. and 6 p.m. Shift work has shown to disrupt normal sleep-wake cycles. It leads to short sleep and excessive fatigue. Some examples of these jobs are nurses, law enforcement, emergency dispatchers, paramedics, firefighters, manufacturing jobs, construction work, mining work, and truck drivers. Studies show that working conditions such as shift work and job strain are both reasonable biological explanations for increased risk of obesity. So, health and sleep. The National Sleep Foundation suggests that young adults between the ages of 18 and 25 years and adults of 26 to 64 years get at least 7 to 9 hours of sleep each night. Older adults, it has it to 7 to 8 hours. The Pittsburgh Sleep Quality Index is a self-administered, standardized way that researchers determine sleep quality, whether it's good or poor. And this is a good tool to use as a clinician to evaluate how well somebody is sleeping. So sleep deprivation and how it correlates to obesity. Sleep deprivation is associated with higher likelihood of obesity and risk of metabolic syndrome. BMI is used to classify weight categories, so anything between 25 and 30 on a BMI measurement is considered overweight, and anything greater than 30 you're considered obese. Studies show that people who report fewer than 7 hours of sleep per night have a 6% increase in probability of obesity. Healthcare costs. Annual economic costs for adult obesity is estimated at $300 billion in the U.S. And then individuals that are defined as obese, those patients, research shows that pay up to 30% higher in healthcare costs than those patients who are not obese. Obesity rates have leveled off in the last 10 years according to research, but the rates are still high. 38% of the U.S. population is considered obese, and 70% are either overweight or obese. So the methods of this study were to investigate the correlation between sleep deprivation, full-time shift work, which is considered 38 hours a week or more, and looking at BMI. A systematic review was done, and it was used peer-reviewed scientific literature between January 2014 and June 2019 using the guidelines from the PRISMA P. 6 internet databases were used, such as PubMed, ProQuest, EBSCO, ProQuest Public Health, and search terms such as sleep deprivation, shift work, BMI, obesity, weight, and body fat were used to search through these different databases. And as you can see, here is a table of these databases and the search terms that were used, the number of hits, and then the number of studies were excluded based off just looking at the title and abstract, based off inclusion and exclusion criteria. And then these were the remaining studies that were left over, and then over further investigation, reading through these articles, more and more were not included in the review. So some of the inclusion criteria: articles published January 2014 to 2019. It had to be peer-reviewed, full text in English, primary research. The preferred study design was randomized controlled trials. The sample size had to be at least 10 subjects per group. Adults between the ages of 18 and 65 years. They were to work at least 30 hours a week or more. They were healthy, no pre-existing health condition, and they got less than 7 hours of sleep a night. The exclusion criteria: any studies before January 2014, if it wasn't in English, if subjects were younger than 18 or older than 65, anyone had a pre-existing medical condition, had sleep apnea, was taking any type of sleeping medication, if they slept more than 7 hours a night, if they were not full-time workers, less than 38 hours a week, if any of the studies were reviews, systematic reviews, and then if their sample size was less than 10 subjects and or a dropout rate of greater than 20%. Some of the themes that I found in this review, this systematic review, was only data that I found were cross-sectional studies and a longitudinal study. So I was a little disappointed in those results. I felt that made my data weak because they weren't randomized control studies. All the studies that I found used questionnaires, and all the studies found that insufficient sleep is highly prevalent within manufacturing sector, or one of the studies found this, and the cause and effect relationship between insufficient sleep and obesity was supported by the research. There was a significant difference in sleep quality based on participants' BMI. Strong association between sleep deprivation and obesity of shift workers. Shift workers have significantly poorer quality of sleep, 65%, than according to the non-shift workers at 35%. All studies showed a correlation between full-time shift work, poor sleep duration, and BMI measurements. More studies are needed to investigate this topic using randomized controlled trials, which would make the quality of grade of this research stronger, in my opinion. So when looking through each of these studies that I found, questionnaires were used. In one study, there was in Texas, there were 228 subjects that were working at a manufacturing plant, and 45% of those subjects reported sleep duration of 6 hours or less. 40% of those were overweight and 44% were obese. In the NICFAR study, again, questionnaire was used. 552 subjects. They were from Tehran, Iran. They were hospital staff, and it was a convenience sampling. Subjects with lower BMI experienced better overnight sleep quality than overweight or obese participants. And the Canuto study, again, questionnaire, took place in Brazil. 905 subjects, they all worked at a poultry plant. 10.8% of those subjects were obese. All workers exhibited sleep deprivation who worked night shifts. Sleep-deprived workers had a higher prevalence of obesity. So another study that was in Japan had 2,758 subjects. 1,179 were day workers. They were used as controls. And 1,579 were rotating shift workers. And it found that BMI was significantly higher in shift workers than day workers. Reynolds' study used a questionnaire. It was done in Perth, Australia. This was a 22-year-old longitudinal study with 873 subjects, all shift workers. People who worked longer work weeks slept an average of 21.7 minutes in males, 22.7 minutes in females, less than those who worked less. BMI higher in those who worked more hours. There was an average BMI of 24.7 in those that worked less than 38 hours, and the BMI was higher at 25.8 who worked 38 or more. So people that work more are sleeping less. People that work more have a higher BMI. In a study in Istanbul, Turkey, there was 202 subjects, all medical center staff. 65% of the subjects with poor sleep quality were found to be shift workers, 35% non-shift workers. So some limitations to the study. As I mentioned before, it would have been ideal to have randomized controlled trials. Instead, I had 5 cross-sectional studies and 1 longitudinal study. Sleep time and hours were self-reported. So there could have been some errors in the reporting. Some people could have over or underestimated how much they were actually sleeping or how much they were actually working. BMI measurement could have been calculated based on an over or underestimated weight, activity level, height, which would not have made it accurate. One of the studies in Japan was all female, which could overgeneralize the results. And then BMI is recognized as an imperfect measure of obesity. It relies on total weight than relative contribution from body fat and muscle mass. So if you have more athletic individuals, that BMI is going to be more inaccurate. The conclusions that I took away from this review was that studies suggest evidence of the association between the shift work, sleep duration, and BMI. There's substantial research on health consequences of sleep deprivation and obesity, and it seems reasonable to suggest that shift workers may benefit from a work site health intervention that focuses on educating the importance of sleep and adverse health consequences of obesity. So having, professions like nursing, people that work in a factory, mining, construction, people that work labor-intensive jobs on rotating shifts would definitely would do better if their organization or their company spent time really telling them this is why it's important to sleep, all the negative health consequences from gaining weight or being overweight or getting obese, and how it could affect their job and their overall health would really help out, and also encouraging them to sleep more. Here's a list of all the references that I used for this review. And thank you for your time, and have a nice day.